I'm Michael Betel, president and founder of the Fatty Liver Alliance. We raise awareness about the risks, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Today, as part of our patient-focused series, Liver Insights, Illuminating the Path Through MASLD and MASH, I am very excited to introduce Dr. Mazen Noureddin, who's a transplant hepatologist at the Houston Methodist Hospital. Dr. Noureddin recently opened the state-of-the-art Houston Research Institute. Previously, he was founding director of the Fatty Liver Program at Cedars-Sinai Medical Center. He's internationally known for his research in MASLD and MASH and is an expert in non-invasive testing and biomarkers. Today, in part two of our special series for patients who have already been diagnosed with MASLD or MASH, we'll be discussing Risk Factors Unearthed, an exploration of the critical risk factors associated with disease progression. Dr. Noureddin, you're a world-renowned expert in this topic, amongst many other topics. What do patients need to know about the risk factors for disease progression?
Mike, good morning, first of all. Howdy from Texas. It's always great to be with you. You're so kind. You're biased because we're friends, and we're friends because of all your work in this liver disease space and increasing awareness, and most recently in MASL and MASH. And I've been watching your videos on the food, by the way, the good food and the bad food. So thank you for doing all this, and
Yes,
I'm
no
happy to
problem.
be here. Yeah, as you mentioned, Mike, it's it's an epidemic that kind of invading the world. It has been around for some time, but it's just gonna get worse and worse. And guess what? And why? It's related to obesity and type 2 diabetes. And unfortunately, both are on the rise. The food is not any better. Again, thanks to you for alerting people to the food. Metabolic syndrome is not any better. Technology is improving, but the footsteps are going the other way around. So it's an epidemic that the estimation about 30 to 35% of population have what's called MASLD, which is in simple terms a fatty liver. Luckily, not everyone is gonna progress, but still significant numbers progress to the subsequent step, which is the more severe, which is MASH. And what is MASH? What's the difference between MASH and MASLD? In simple words, MASLD is just fat in the liver. MASH, I tell my patients, gas on fire, which is when the body says, hey, I should not have that extra fat in the liver, and the body sends signal of inflammation. That's not infectious, that's not contagious, it's just immune response and a lot of responses. And eventually you get the scar tissue, like when you get a cut, wound healing, that scar, it helps you healing, and that's what the liver thinks initially it's doing. But eventually these scars get your liver into a scar shape, which is cirrhosis. People think, as you know, like the first thing we tell them if they have cirrhosis, you have cirrhosis, and they say, I don't drink, doc. And unfortunately, this happens without drinking. It does happen in people with metabolic syndrome features, which is diabetes, high blood pressure, obesity, as well as dyslipidemia, which is high cholesterol.
Okay, that's a good explanation. And you have some visuals for us, I think, right?
Yeah, yes, sir. Let me take you to my slide to so uh this is kind of the global effect of MASL around the world. And as you see in America, the estimation at least 31%. This is a paper we published a few years ago as MASL became the first leading cause of chronic liver disease here on the top, and in different ethnicities and race groups. And it varied, like the number one cause sometimes could be different, but overall, the totality, MASL is the leading cause of chronic liver disease as well as cirrhosis. Let me show you here. So, Mike, I think you wanted me to tell your audience is not just like when they have MASL, but also the next step, which is MASH. How can you be alert? So back in the days when I used, and this is important for the patients, I just got a text this morning from cardiologist like, good morning, I'm seeing your patient today for you sent her for to check on her heart, which is very important in patient with MASL, and he said the following: LFTs are okay, so I'm not too worried about her. So LFT is it's called it's a common term for liver enzymes, and he said it's 37. And I sent him text back, and I'm like, listen, she has advanced fibrosis, which is pre-cirrhosis F3, and the liver enzymes will not matter much. So here for our audience on this podcast, what I want to show you here the factors associated with MASLD as well as MASH. And this patient that I'm talking about, particularly today, she has new onset diabetes. She does have dyslipidemia, and she has obesity. So, in general, metabolic syndrome, which contains type 2 diabetes, obesity, high blood pressure, is a very important factor. In addition to those, you do have other factors, but what I want the patients to pay attention to is the following. Uh, what I mentioned, type 2 diabetes, obesity, high blood pressure, and cholesterol. But also there are other things. Sleep apnea is very important one. Some people have a skin condition called psoriasis. This is a very important one. Some women, and I see a lot of MASL in these people, they have polycystic ovary syndrome, and you see a lot of MASL in these patients. So I just want to jump to the last slide, and I just show you here in the medical term we use odds ratio, but it's basically how likely you are to have MASLD and MASH and scarring of the liver. So here I show you if hypertension, high blood pressure, this likelihood is high. Diabetes is higher, but when you start combining them, it's getting higher and higher. Look here, if you have high blood pressure, diabetes, and being overweight, it really increases risk significantly. So these things are always should be taken in consideration. So I tell my patients, or I tell my primary care docs or the cardiologist, if you do have patients with multiple risk factors, don't tell me the liver enzymes are okay. Really, we have to do further assessment in these patients. So again, it's not the liver enzymes that I used to look for when I have hepatitis C or viral hepatitis. That's a different disease. That's a different thing. Here, when they come to me, I read their past medical history. I'm like, look, diabetes, the BMI is 38, the blood pressure is on medications, sleep apnea, all those, they uh, they bring it to a higher level of attention, and that we need to do more for these people.
Yeah, you mentioned as well that uh, people make the assumption about alcohol because of the cirrhosis. And, there was the terminology non-alcoholic fatty liver disease before, and now it's changed to MASL. And the metabolic involvement is what you talked about today. And there are so many things that patients can actually do for themselves. There will be medications that are going to be approved, and it's important for patients to know that they can control their destiny with their health, their liver health, with some lifestyle changes. Maybe you can just briefly talk about some of those metabolic comorbidities that you mentioned and how patients can help themselves, and maybe some of it is medication related as well. They can be treated for some of those symptoms as well, right?
Yeah, a very important question, Mike. And I just in case I know like you're announcing this, but you have other programs in this series, and I think Dr. Abdul Malik is gonna talk about diet and their medications consideration as well. But if you do have type 2 diabetes, make sure your A1C is well controlled. Make sure even if you are on medication, don't keep it at 6.6, bring it less than 6, 5.7, and control that type 2 diabetes. And there are multiple type 2 diabetes medications. People take metformin, for instance, but the new guidelines, such as American Gastroenterology Association, the American Association for the Study of Liver Disease, they tell you not to shy away from the newer generation of type 2 diabetes medications and weight loss medications, such as GLP-1s. So that's important. Hypertension, you can control it. Dyslipidemia, and this is an important point. You need to control it because it predisposes you to heart disease. And that's why my patient this morning is at the cardiologist office. He wants to use statin. Be my guest. Control it. 2 points about statins here. The statins are important to control dyslipidemia in MASL patients, and they die from heart disease. Nevertheless, it does not um, treat the disease. So a lot of people say, well, this reduced fat is going to reduce the fat in my liver. That is not true. They haven't proven not to do so. It's important. It protects the heart. In addition, also the other way around, a lot of people when have elevated liver enzymes, first thing they take off statins, thinking the statin is causing this, and they come to hepatologists. We put them back on it. So that's another important thing. Sleep apnea, control it. That's very important. Weight reduction is very important. So all this, I call them the cousin diseases. They come together. You have to break them off, and you
And
have to
yeah.
control them.
And I think it's really important. And I'll be the first to admit that it's very common, and I myself struggle with a number of those risks. I have sleep apnea, and I take cholesterol medication, and I'm controlling. I was pre-diabetic, and so I put that, as you said, to try to keep it under 6. And so I think if patients take care of, and they have to do it with their healthcare practitioner that they work with, of course, and they should just deal with one issue at a time for this tailored care. And together, if they take care of the metabolic disorders, that will make a big difference in their liver health, right?
Indeed,
That's it.
and,
That's
and absolutely.
Thank you. Your the words of wisdom today for Dr. Noureddin. Thank you for sharing with patients. I know so many are going to appreciate it and learn from it, and I appreciate you and what you do every day. Thank you.
We appreciate you as well, Mike. Keep up the good work. And for our patients, the 2024 is a good year. Hopefully, we will have options for the patients soon. We have progress in the field. We're actually now trying to target the people with cirrhosis to see if we can help them and introduce therapies. So stay tuned, 2024. This is an exciting year.
Can't wait.